Hi, good afternoon. This is Scott Fischer with Options for Senior Living. Welcome to my backyard, a place where I do a lot of my early morning time or end of the day time where I can kind of collect my thoughts, think through the day, and get acclimated for the day. So it's a great relaxing spot for me, and I thought this would be a great place to share this afternoon. The question comes to me is what kind of services do you provide? I've talked in the past about our services that are free, and I kind of talked about or outlined a particular process by which we do, but it goes beyond that. And I had a funny thought. I was thinking about it. I was like, how many times has someone said to me, you can't put me in one of them places, or a husband has promised his wife he would never put her in one of them places, and he's really referring to an institution like what we in our mind think about an old skilled nursing facility or a nursing home, where often the residents of that facility are all wheelchair bound. They're all rolled out in front of the nurse's station about 4:15 just before dinner every day, and it just feels cold and impersonal and institutional. People are wearing scrubs, and the first thing I want to tell you about assisted living is, particularly in the metropolitan Phoenix areas, assisted living is nice. It is upscale living for most people. There are literally hundreds and hundreds of wonderful assisted living homes and centers all over Maricopa County, and there are a number of new facilities slated to be built here in Maricopa County just in the next couple of years. So once we take that initial assessment and we work through, we want to get through some other things with families too, and some other resources might be needed at some particular time in our process. One of the first questions I always ask as well is, have you done your powers of attorney? Is your life care planning done in advance? Is there any need for application for state funding? And we call it the Altex program. It's the state's Medicaid funding program. And so sometimes we need to find an elder law attorney or a paraprofessional who's skilled at walking through, in their businesses, walking families through that Medicaid application process. So that's an additional resource that we might offer to people. Sometimes when they come out of a facility after a hospitalization, they've had an illness or a fall, we often need to incorporate home health. That's a Medicare benefit where nursing and therapy can come to people's homes or come to their assisted living facility and help support them in their recovery process. Unfortunately, I also deal with a lot of people that are at the end of life. They're in the last several months of their life. And so sometimes we have to incorporate hospice care. Hospice care is not a place necessarily. It's a Medicare benefit that people have access to support them with comfort measures through the end of life. And so those hospice nurses, social workers, and resources will come to their assisted living home or facility and literally support that resident right through the end of their life. We also want to help you determine what's the right level of care that someone needs. Someone goes, how do you know what level of care they need? And so here's where, working with Options is to your benefit. I have over 30 years of working with the healthcare system. I have a degree in nursing. I was in nursing administration, nursing and education. I have an emphasis in senior mental health since the year 2000. So these are the things that we know about. My staff and I personally oversee every one of our cases so that families get assessed and we're guiding them to the right level of care. Assisted living has 3 levels of care that most people don't even know about, and it would be important for us to identify the facilities that are licensed at the right designation, right level of care, so that your loved one never has to move again if that's a priority for you. Anyways, thanks for joining me in my backyard today. It's been great to share. Have a great afternoon.